Hey, thanks for joining us. Gil, you have this thing that your wife noticed on your back. What did she say it looked like, or what was going on with it?
She just mentioned that it was irregular, a little dark, and to have you look at it.
Okay, so we'll take a look at that and see that indeed it does have asymmetry and an irregular border, and also is larger than 6 millimeters. So those are all things that we use as criteria to decide that it should probably be removed. You know, if we hit 3 of those, certainly we should take a look at it. And it's different from other lesions on your skin when we look at you. I'm using a combination of lidocaine and epinephrine with some buffer, some sodium bicarbonate buffer that helps it to not sting quite as much. I use a 4 millimeter punch biopsy instrument that allows us to get a little cylinder of the tissue for analysis. And I should go over the ABCDEs of skin lesion evaluation. So I'm going to get the major portion of this, but I want to get a little bit of this tail here too. So I'm going to go right where they connect, get a little bit of both. So in assessing skin lesions to see if they are concerning for skin cancer and worthy of biopsy, there's kind of an alphabetical system, the ABCDEs. Asymmetry, and this one has asymmetry. It goes off with that tail up on one side. You know, you look, if you split it down the middle, you know, down the middle this way or down the middle this way, do the two halves look like mirror images of each other? And this one they don't. So asymmetry is A. B is border irregularity, and this one's border is irregular with that tail going off there. I'm going to put that in the little sample container here. C is color not uniform, so there's like variation in the color from one part to another. This one doesn't really have that so much. D is for diameter. A diameter greater than 6 millimeters is concerning, or the size of a pencil eraser, and this one is larger than that. It's about 12 millimeters from here to here. And E, evolving size, shape, or color. Any changing, anything that's, especially if it's changing rapidly, we get concerned. This one wasn't changing, but it does have 3 points for the asymmetry, the border irregularity, and the diameter greater than 6 millimeter. Okay. And then the orientation of this particular punch is more left to right or horizontal. So I'm going to put my suture in, kind of a top to bottom. You still okay, Gil?
Yes.
Okay. Pull that out, pull that out. Don't want to go quite that far. We'll just go over here. There we go. Put that in and close it up. And we'll have the results in, well, probably next week. So it'll probably get a phone call from our office telling you most likely the results are benign. If it did happen to be a malignant melanoma, if it's still in the skin and hasn't broken through the basement membrane, we would do a larger excision to take out the lesion and 4 millimeters around it on all sides in the shape of an ellipse. If it were deeper than that, we'd refer to a dermatologist. And we do want to get that suture out in, a week to 10 days. So how was it?
It wasn't painful. It was good. It was comfortable.
Okay.
Yeah.
So we'll get the results in 7 to 10 days and let you know and see if we need to go another step or not.
Yeah.
Hopefully it's just a benign mole, kind of like the other ones you have on your body. This one just happened to have those features to it.
Sure.
But we do encourage you to look for those ABCDE features that we went over. And I'll give you a little printout of that too.
Okay.
Hey, thanks for joining us. If you like videos like this, make sure you're subscribed to the channel. And if you want to see this plus some behind the scenes stuff from the Auburn Medical Group, you can become a patron through Patreon. And until next time, Gil, myself, Dr. Mark Vaughan, telling you to stay in good health.